Thank you so much for being here, Dr. Weber, Jenny from Weber and Weber Company. It's a very exciting podcast for me to record with you both. Just as a quick preamble, I'm very excited that both of you will be at the Health Optimization Medicine and Practice Symposium, December 11th and 12th in Las Vegas, right before A4M. This is going to be held at Caesar's Palace, and Dr. Weber is coming all the way from Germany. Jenny's coming all the way from the beautiful part of San Diego or Tijuana, where she may be hiding and doing clinical practice over there. And I'm very excited to have them. And Dr. Weber, you're one of the sort of the legends in the field of laser medicine. There's so many things that I wanted to ask you, but one thing that I thought might be an interesting way in is what we were just talking about, which is photosensitization. Can you talk about how you do this using the various laser technologies that you have and what you've noticed to be really, really helpful for various types of the conditions and processes?
Yeah, light therapy or laser therapy is another expression, has already a long history. If we look back the last 40, 50 years, it was developed originally in Hungary and in Russia. And in the late 19th, this technology came also to Western Europe. And the first and good research was really done in the Eastern country. And lasers were used in the beginning for wound healing. So could show already regenerative effect for lasers, but lasers also was used for pain therapy. And when we started this project about 20 years ago, we used lasers first mostly for pain management, for arthritis, for acupuncture also. And then we developed a new fiber optic system, what was really new on the market, with different lasers, up to 12 lasers, one machines, and with special fibers so that we could lead the lasers of different colors right into the skin to achieve healing effect, antispasmodic and inflammatory effect, regenerative effect. Then came what's very, very new. We developed an internal laser machine, because lasers, when you apply them on the skin, they can only penetrate with a certain amount, a little bit in the tissue, but can never go into the heart or liver or somewhere else. So we developed the first invasive laser machine where we could put the laser right into the bloodstream or maybe in joints or something. And we had amazing effects of regeneration of lasers. And then we started a lot of research in different universities. And now we know a lot more what's really happening with lasers, especially on the cellular level. Maybe Jenny want to add something?
Yes. Well, I mean, I've been honored to work with Weber Medical and Dr. Weber and the team for years now. And I've been running a research clinic where we focus on mainly oncology and kind of chronic autoimmune conditions, as well as regenerative, right? We're always striving to find the best that we can and working as a collaborative team. And sometimes it's, as we all know, in this aspect where we're researching, but also applying treatment and working to see the patterns to improve upon those therapies, to offer better things to our colleagues and share, but also offer better to our patients and clients, right? So what I am on the biological level that Dr. Weber is just speaking of, the effects that we've seen with the synergy of the intravenous laser therapy has been quite impressive, to say the least, that we've all of us get some success or results with what we do. But when we can truly combine effectively between timing, dosing, precision, and something is specific about what Dr. Weber has created and working on, it can truly create a synergistic effect and enhance on a biological level, especially when you combine agents like IV therapies, natural agents, and different wavelengths of light. So that's my quick comment on the side of how exciting and unlimited this field actually truly is.
Yeah, that's great. So when you're talking about, interventional or invasive laser therapy, we're talking about actually accessing a joint or accessing a vein. I would imagine maybe other locations as well that you've tried. When you talk about it being sort of interventional, you're shining a light, and we can talk about the different spectrums of light that we're using, but just like sort of high level, you're shining a light into a vein or a blood vessel. How does it become more systemic? Is it getting into the bloodstream itself somehow, or what is the mechanism? Do we understand like how it actually becomes a systemic stimulus?
Yeah. First of all, if we speak about light, sunlight, it has different wavelengths, shorter and longer wavelengths. So today we have the full spectrum available. In the beginning, we had only 20 years ago red infrared lasers, but today we have blue, we have green, we have yellow, we have near infrared, we have ultraviolet. So the question is from your side, what is laser light doing systemically? First of all, if we give a laser in the bloodstream, there are different effects. First of all, the red laser brings energy inside. Sometimes you can a little bit combine with Chinese medicine. You know, the red is the fire, is like the heart, which brings power into the body, especially in chronic and exhausting diseases where people are weak, they're depressed and something. That's the red laser, what we know. But red laser has more effect. It improves the rheology of the blood, so the blood is flowing better. So it prevents thrombotic events, for example. It has an anticoagulative effect. And then when we look on the next color, the green one, green is in the nature connected with chlorophyll, and we produce oxygen. So with green, we have a lot of better oxygen available and binding to hemoglobin. So first of all, we improve the blood flow and we improve the oxygen. And then comes the blue. And the blue is amazing light because blue improves nitric oxide, what we produce normally in our blood vessel. But it's a radical, it's not free. But when it's irradiated in the blood, binding to hemoglobin, it becomes free and it improves the microcirculation by widening the capillaries. So better blood flow, more oxygen, opening the microcirculation. And then look at the yellow, for example. Yellow, I always say, is like the sunshine, in the bloodstream, brings everything inside, has a huge antidepressive effect. And in Chinese medicine, it removes the blocking of the so-called meridian so that the energy has a better flow in the body. But on the other hand, it has great anti-inflammatory effects as well, and also on hormone production. So there's a lot of different effects. And then the ultraviolet, we know long time that ultraviolet, of course, can kill viruses, bacteria, so it has this antimicrobial effect. The well-known effect, what we have seen in the last years, but the research, which is exploding in the moment, has shown in new research in the last 2 years that we increase the number of our own stem cells in the blood. We increase cytokines in the blood. And what is amazing from new research, what we will publish soon, we even can increase the length of telomeres, which are responsible for our life expectations. So it's a lot of new things going on. And that's something, in short, to answer your question for systemic effects.
So I understand that there's systemic effects. I totally, and I've read some of the research and I know, I wonder if we have a sense of, we talk about if you're shining a light in and you have, an IV laser, right? It's only affecting a certain small amount of tissue, right? Or a small amount of blood in the case if it's red light, like you're discussing. But it's because of this small amount of exposure that causes like a systemic chain reaction, we think, and that causes more of the full body and mind and brain to be affected.
We let the catheter with the laser application inside for around at least 1 hour. So it's not only a small amount of blood. If you have a good vein, you reach.
Right. So if it's an hour, you're right. Okay. Gotcha. You're getting circulation.
What I was going to say is I think that some of the listeners, what might help Dr. Scott tell me if this is right, is it seems like that not everyone may know exactly what we're talking about when we say systemic. How is it doing that? So is that right?
I think at the end, to my knowledge and all this research, at the end, the regenerative effect of intravenous systemic laser therapy is the stimulation of our own stem cells in the bloodstream. First of all, we know that we are increasing the number, but you treat the patients with a very bad heart function, maybe only 15%, and you treat him 10 times and it's going up to 25. And you have to ask, how does this work? You give some light photons into the blood and the heart getting better, or kidney function or liver function. I think one of the main effects, beside all the cytokines and everything, is the stimulation of our own stem cells in the bloodstream.
Makes sense. Yeah. So Jenny, I know you have a clinic there in Mexico, and you've been using Weber's technology for a long period of time. Tell us some about some of the patients that you've kind of worked with, some of the treatments that you've done, just to give a feel of like the clinical side of this, if you can, a little bit, and just kind of give us an understanding of what that looks like from a clinical practice perspective, how you've been implementing it over the years.
Yeah, no, of course, absolutely. For those of you who are kind of familiar with what the Weber is, there's the different applications, right? So there's the large unit that Dr. Weber is referring to now that we're discussing, the endolaser. And the endolaser was designed for, it does have FDA approval for topical applications in pain with specific diodes. But the other uses for many, many years, both in Dr. Weber's clinic as well as my own and others that we collaborate and work with, have been the topical, yes, but you can all the intravenous application as well as the interarticular. And for us over here, we do the intratumoral, right? And the oncology side is a little bit more complicated and takes a lot of energy because we see that some things work so brilliantly and beautifully while others get a certain response, but what's the difference? So this is where we've been continuing to improve upon those protocols and how we can make them better. And it's a lot of work, but it's exciting and fun because we can integrate between. So when we utilize this particular unit, we're utilizing it in different ways. So there is just like a 22 gauge catheter goes in your arm, or 24 or 21, depending what treatment you're doing. You need at least a 22 gauge because once the catheter is in place, the needle comes out and you have the catheter, the plastic piece that's sitting in the vein. There's a sterile fiber optic line that threads through that, twists on, and that connects to the diode of the machine through a cable. And that cable from each diode is what passes the light to the intravenous. And the concept is that the peripheral blood system is passing through. And someone said to me once, Dr. Weber, correct me if I'm off on this one, but someone said to me, well, wait a minute, how's it going to get the blood in the body? The blood doesn't pass through there. And I said, well, if it didn't pass through there, I'd be a little concerned that we wouldn't be breathing right now. So we know how much volume exactly. We have a general concept known on certain standards of how the metabolism works and how quickly our bodies process. But yes, we're getting X amount of time on each laser color should expose a very large amount of your blood circulating into the whole system. But then we have another one, which is we can also do interarticular into joints with PRP or stem cells. And again, we even have documents and studies showing certain wavelengths of light can actually increase the effectiveness of the cells, like Dr. Weber was saying, reduces inflammation, increases ATP and mitochondria function, but also we're upregulating oxygen into there too. And you use stem cells or PRP or any of these things, we're making it much more effective because we're creating a synergistic effect. And then another one, I can keep going. Another one would be the topical applications, anywhere topically, transcranial, as well as laser acupuncture, meaning you do not need to take a needle. There's a silver tip on some of the cables with little stickies that can go on very specific acupoints all over the body. And again, it's putting a certain amount of light. Usually this is done with infrared and or red, but normally infrared because of the penetration depth to the skin.
Right.
So these are just some ways in my own clinic we've been doing this. And then on the oncology side, we do prostate infections as well as people with oncology. We look to support the systems by doing transurethral applications or transrectal applications or ultrasound guided to specific areas of tumors. So we have been doing immunotherapy, biologic treatments, keeping record of the treatments through the years, seeing what works more effectively. And that's what I've been so honored working with the Weber team and family. I'm very blessed because we're finding all these ways that all these modalities can actually fit together. And I think that's a unique thing about the laser therapy because it doesn't take the place of anything particularly. It is its own. However, it integrates with anything we have because of the synergistic effects. That was just the professional device. Then there's the other ones of like the endolight on the wrist and the helmet and all those really cool things. But if I don't stop talking, I will keep talking. So I think Dr.
No, it's
Weber,
all good. Dr. Weber, do you have anything to add there?
Was that accurate, Dr. Weber?
Yeah. First of all, we have to clarify. Jenny spoke a little bit about arthritis and everything, a little bit oncology. First, we have to clarify what shows you that with laser therapy, you can nearly affect the whole range of medicine. And what is very important, we have to distinguish between phototherapy, where we give light into the body, maybe in a joint or somewhere else for regeneration. And this is something what we call photobiomodulation, because when laser light meets the mitochondria in our cell, which produce our life energy, then, all these components in the cell, because they are made from light, in the evolution, they will the light, they will be stimulated, and then we have a higher amount of energy, the so-called ATP, which provides, but it's not only ATP, we also produce a little bit nitric oxide, some small amount of oxygen radicals, which then affects the cell nucleus by so-called second messengers, which then leads to gene transcription and renewal and regeneration of cells. That's the regenerative effect, what we call today photobiomodulation, PBM. But on the other hand, and so we want to push the good cells. Yeah. On the other hand, we want to destroy the bad cells in the body. It means cancer cells, but also, for example, microbes, viruses, bacteria, fungus, everything like this. And this is so-called photodynamic therapy. That means we use the laser in combination with a light-sensitive substance like methylene blue, what you already mentioned, can be riboflavin, vitamin B2, or derivatives from the chlorophyll, the so-called chlorines. We give them to the body, they bind maybe to cancer cells or microbes. And when we then stimulate them with the right light according to their so-called absorption spectrum, we produce a lot of different radicals which then destroy the bad cells. And this makes laser therapy so amazing. On one hand, we can regenerate the whole body. On the other hand, we can remove the bad cells from the body. That makes it so interesting and so wide. There's nearly nothing what we cannot treat, even additionally with laser therapy.
So I think you make a really good distinction here, a really good point that there's a difference between PBM, photobiomodulation, and photodynamic therapy. What I was trying to understand is, what does that mean in practice? What is different about the administration of PBM versus photodynamic therapy? Other than I do understand that the photodynamic therapy, sometimes can include sensitizers, but it doesn't always have to, right?
So yes, you have photobiomodulation and photodynamic. Photobiomodulation is the use of any light, whether it's LED or laser. It's the effectiveness of photobiomodulating. It's creating a modulated effect on the human body via photons, right? And wavelength lights. Photodynamic is the use of a natural or pharmaceutical substance used along the same moment with the corresponding wavelength of light that it reacts or absorbs to. And at that same moment, when it's applied, it creates a photodynamic therapy approach, which, and the best term I can think of right now, activates or enhances each other. And then the photosensitizers or photosensitization with laser therapy would be considered a type of photodynamic, but photodynamic is specific when you have an agent and the laser corresponding directly at the same time to affect either a pathogen, or you're looking to affect a microbe or a cell. Then you have something that makes the body more susceptible to a certain wavelength or spectrum of lights. Now, every natural and pharmaceutical substance has this, right? You can go to, this photoluminescence testing. I mean, I didn't even know this when I first started in this field. It was basically looking at, you can type into Google green tea extract, NM for nanometer absorption rate, and you will get a ton of scholarly articles and wavelength ranges. Now, it depends on the product, the combination, what else is there. Even pharmacies and physicians will prescribe to their patients. We'll jump in and see a prescription that says, be careful of the sunlight, right? So that agent is making you more sensitive to a certain spectrum or color of light. So that's the concept of utilizing sensitizers. And curcumin, for example, is one. Methylene blue ranges that peak absorption from the scientific perspective, and then the methylene blue range with red. I believe it's 660 or 658 exactly, something in that range. So it's red light. So we look at the different substances and look to apply them at synergistic corresponding times to create a sensitizing effect, get more benefit from the methylene blue and the laser. Then you can do just laser on its own, and then you can do them at the exact same time or targeted, which is a photodynamic therapy approach, which is to actually create a specific target. I hope that makes sense. And I know
it does. Yeah.
We're waiting for Dr. Weber.
Yeah, so that's okay. Dr. Weber, we lost him for a minute. Maybe he'll come back. But I think that, overall, I just wanted to give a bit of an overview today with you, Jenny, and Dr. Weber. Maybe we can find a little bit of a longer time to go into more details as well. But I think this is a really great introduction to photobiomodulation, to photodynamic therapy, to lasers, to the Weber framework, and looking at things in such a different perspective of medicine than we're typically used to, especially when you're talking about like synergizing and using it in oncologic cases, in regenerative medicine cases, intra-articular, intratumoral. Like there's so many different applications of this. So I'm really excited to have you both at our conference in Vegas in December 11th and 12th. If those that are interested, they can come over to homehope.org and get your ticket. We are running out of tickets though, probably by the time this comes out. So get them soon. Jenny, it's really good to see you. Thank you for spending a little bit of time with me. Please give Dr. Weber my best as well. We'll get him back with you both for a longer podcast where we go through, I want to go through a lot more detail as well for everybody. but they can come to see Dr. Weber speak at the conference and learn all about the history of Weber and all the amazing things that you both are doing from a clinical perspective and from an investigational perspective, academic perspective, and all those things. So yeah, any final words before we part?
I just want to say thank you. Stop everything you're doing in this field too. And you created some amazing platforms, foundations, and educational ways to help our colleagues as well as patients. Your products are awesome. So we thank you for collaborating and thank you for having us.
My pleasure. Okay, you guys, everybody have a good rest of your day. Go to homehope.org. Get your ticket soon before we run out. And I wish you all a great rest of your day. Take care.
Please join us. Bye-bye.